What makes a birth traumatic? Maybe you've heard that phrase, traumatic childbirth, or you had a really difficult birth and you were wondering if it was traumatic. In this video, I'm going to go over what creates trauma, what are the contributing factors to a traumatic experience. And by the end of this video, I hope you have an understanding of why it's so worthwhile to heal trauma. I'm Allison Lorne, certified nurse midwife, and I help people recover from difficult and traumatic childbirth experiences. Download my free postpartum care checklist. It's full of tips and tricks to create more ease and comfort in your postpartum period. And please click the link on my bio and visit my website to learn more about what my offerings include. So, what makes trauma happen? Why are some people traumatized while others aren't? What I learned in nursing school was a really simple definition of trauma. It's when you feel out of control of your circumstances, combined with a fear for your well being or those of your loved ones. And this includes the unborn baby. So, when we have that condition, it's a setup for when a traumatic experience could occur. Now, some people might feel like they don't have control of their circumstances and they have fear, yet they're available emotionally to process information as it's coming in. On the other hand, somebody that feels overwhelmed and isn't able to emotionally process all the stimulation might have to put that experience in a box, so to speak. It's like putting that experience away for the time being because it's too hard to understand what's happening. And trauma responses that include fight, flight, freeze, or fawn, like I've gone over in another video, take over our emotional coping in order to get by, in order to survive. Now, trauma usually feels like it was barely a survival situation. Trauma tends to linger, it leaves an energetic imprint in the psyche, and it feels like a haunting. Like there's a cloud or a ghost of this experience that follows you through in your daily life and makes it harder to complete normal activities, engage with others the way that you used to feel safe in the world at large. Now, all of that is due to trauma not being able to be integrated. There was this study that showed it was incredibly useful and effective for providers to check in with their patients in the first 48 hours after delivery to see how the delivery went and help process and integrate the experience, as well as just a single phone call in the 6 week period before the 6 week follow up postpartum exam. If we just created that small piece of care as a touchstone and required element of our postpartum follow up, we would be helping so many people integrate a traumatic childbirth event. Unfortunately, we don't talk enough about childbirth related trauma, and these traumas end up following people. Now, you might think I can just put that aside, get through these toddler years, raise my newborn, deal with the day to day stressors, maybe even get back to work, how to keep your household going. And it might not be until there's like another subsequent pregnancy that really forces you to reckon with previous trauma. Unfortunately, that can really feel stressful and high pressure situation when you have this incredible fear of things happening all over again. Unhealed trauma really leads us to expect more trauma. And that's why healing trauma is so important. It can really help you clear the slate and have high hopes for a new kind of experience. A subsequent birth doesn't have to be terrible, even if your first birth was really rough. Healing the trauma around your first birth will actually make it easier to have a successful following delivery. This is the work that I'm really invested in helping people with. If you get to my website and fill out an application, you'll find that I offer an online community of people that have gone through similar experiences and are invested in helping others move through their own trauma. My work one on one is about helping rewrite the birth story, finding in that birth story when there was a loss of agency, where the lack of control happened, where the trauma landed, and how we can find a way to bring forward themes of heroism and resilience and strength. It's really about capitalizing on your strength of character and finding a way to have resolution with the events that happened in the past. Now, some of the contributing factors to what makes trauma happen, geez, number one is history of trauma. So there you go. It's so important to heal past trauma to prevent more trauma from happening. Unfortunately, another contributing factor is a history of abuse. And we're talking about sexual, physical, emotional abuse. Now, this might be hard because it might feel like you've gotten through your abuse history, or you got to a place where at least you weren't thinking about it or feel totally affected by it all the time. But a pregnancy naturally can bring up the stress of previous abuse because you're vulnerable, you're going to appointments and being asked personal questions, you're having to report on your health, you're having to trust others with your body. And those are just, it's a full list of triggers that, of course, a history of abuse could start to come forward. Share that information with your provider. It helps them become more sensitive to your needs. So, when we're talking about a history of abuse, doing that work and healing the trauma of the abuse is also really important for creating a better chance at having a successful outcome with your birth. Other factors include having a mismatched expectation of what labor and delivery is going to look like. And this is why it's so important to communicate with your providers about what your wishes and hopes and desires are for your birth, and to also enroll in childbirth education classes, either offered through your provider or independently. This can really help you prepare for like all the different variables that might happen in birth and get a sense that it's really helpful to be flexible in your plans around what your requests are in birth. Now, a birth plan is something that helps you communicate what your needs and desires are to your provider and to your care team. And I think I'll go over that in another video in more depth. It's really helpful to help you prioritize what your most important wishes and desires are. So, the other biggest contributing factor I see to trauma in childbirth is a mistrust of the medical healthcare system. And I get it. I totally understand how it can be hard to trust the system. But what we want to do is create more ease in the relationship with you and your provider and with the hospital. Over 90% of people deliver in the hospitals. So, if it's available to you, take a tour of the hospital, take the childbirth education classes offered by the hospital, talk to your provider about what your fears and concerns might be about being in the hospital. Even if you plan to deliver outside of the hospital, which is my preferred model of care for healthy, low risk families, it's really wise to prepare yourself for the possibility of a transfer. And that might happen that you have to go to the hospital. It might happen that a C section is the best thing for the safety of you and your baby. At the same time, it might be the last thing you want to do. But can we find a way to manage those expectations and build trust with the hospital system and your care team so that you feel like you're going to be well cared for? This helps find more control of the circumstances. When we're talking about that definition of trauma and the setup for trauma, if you feel out of control of your circumstances, it's like you go to the hospital and a transfer, you weren't expecting to have a transfer. Suddenly everything's foreign, and the thought of having a C section is just completely overwhelming and bewildering. Versus if you prepare for the possibility, it's less likely that you feel so out of control. Those are a few of the things to help reduce the chance of having trauma. Now, sometimes even with all the preparation, trauma still occurs. And the most important thing is to try to get to processing and integrating that trauma as soon as it happens. That being said, it's still worthwhile years later. Sometimes it comes up, and that's the time to integrate that trauma. It's just going to be there for you to work with. And it's something that's only going to help you be closer to yourself, find more comfort in your own skin, and create more authenticity in your relationships. In bonding with your newborn and returning to intimacy with your partner and showing up fully present for friends and family, all of this are the benefits of healing trauma. I'm Allison Lorne. Thanks so much for watching, and I hope this video has helped you understand why healing trauma is important. Visit my website to learn more, and please download the postpartum care checklist. This is Holistic Birth Recovery.